Welcome back guys. Now in this video, let's begin with the pathology of the nervous system. So in this video, I will be mainly concentrating on the basics. Okay, I will be mainly concentrating on the basics. Now in the nervous system, how many types of cells are there? There are actually two types of cells. One is the neurons and the glial cells. Okay, the neurons and the glial cells. You know the neurons are the functional units. They are the functional units. They are the ones which are producing the action potentials, helping the connection of the electrical impulses, the neurons, you know it. Now what are the glial cells? They are the supporting cells. Supporting cells. See, they create an environment in which the neurons are functioning properly. They are like a nursing cells. They helps in the functioning of the neurons. So two types of cells are completed, neurons and glial cells, and there are different types of neurons are there, you know it. Okay, there are unipolar neurons, bipolar neurons, pseudo-unipolar neurons, okay, and multipolar neurons. Different types of neurons are there. Here what I want you to know in the pathology is there are different types of glial cells. What are the different types of glial cells? So the glial cells include, okay, I am talking about the glial cells now. The glial cells include oligodendrocytes, okay, oligodendrocytes. Second one, ependymal cells, okay, ependymal cells. Third, astrocytes and microglia. Okay, so there are these four different types of the glial cells. They are present in central nervous system. They are all present in the central nervous system. Okay. Now, what are the glial cells which are present in the peripheral nervous system? In peripheral nervous system, there are satellite cells and Schwann cells. They are present in peripheral nervous system. Their functions we will discuss later. But generally, I am talking here, there are different types of glial cells which are present in both central nervous system and peripheral nervous system. Okay. Now, let me tell you something important here. See these glial cells, okay, all these glial cells, whatever I am showing. So they are derived from which germ layer? You know, the nervous system is derived from the neuroectoderm. Okay, even glial cells are derived from neuroectoderm. Okay, but one exception is the microglia. I hope you already know it, the microglial cells. The microglial cells are what? Microglial cells are nothing but the macrophages within the central nervous system. Okay, the microglia are nothing but the macrophages which came into the tissue and they settled over there in the central nervous system, they settled. Okay, so this microglia, they are nothing but the macrophages. If they are macrophages means from where macrophages will come? From the monocytes. Macrophages are derived from the monocytes. The blood monocytes, after entering into the tissue, they become macrophages. Now from where monocytes came? So from where the hematopoiesis is occurring? Bone marrow. So bone marrow, all these like blood cells, there are mesodermal in origin. So the macroglial cells are mesodermal, okay, in origin. So what are the microglia? Microglia are nothing but macrophages. Where? In brain. Or I should say in the central nervous system, microglia. Okay. Now let us discuss about these macrophages in the brain. Okay, the macrophages in the brain are called as the microglial cells. Now, if in certain conditions, what you will see is elongated microglia. Okay, they will use this word elongated microglial cells. Elongated microglial cells are also called as the rod cells. They are seen in which condition? They are seen in neurosyphilis. Okay, so in a condition called as a neurosyphilis because of a treponema pallidum, say the treponema pallidum, which is a spirochete. One can acquire this spirochete by sexually transmitted routes. Now once you get this treponema pallidum, like the patient is going to have stages, okay, stages of infection like primary syphilis, secondary syphilis, and the tertiary syphilis, and the final most stage, the most complicated stage, that is the neurosyphilis, where the central nervous system is getting affected because of this treponema pallidum. Now the central nervous system involvement is going to cause a rod-shaped cells or rod-looking, okay, rod-looking microglial cells. Okay, so simple thing. rod cells or elongated microglia are seen in a condition called as tertiary syphilis because of Treponema pallidum. Now, there are certain cells called as the jitter cells. Jitter cells also called as Ortega cells. Sir, what are these jitter cells or Ortega cells? See, these cells are also macrophages. They are eating the myelin. Okay, they are consuming the myelin. Okay, around the neurons there will be myelination, right? So that myelin is getting eaten up. This is called as, these cells are also called as the lipophages. Okay, so lipophages. So lipo means lipids. The myelin is nothing but a lipid, right? And phages means what? The cells which are eating. Okay, the macrophages, something like that. Okay, so the macrophages which are eating up this myelin, the macrophages which are loaded with this myelin are called as the jitter cells or Ortega cells. Okay, you will see, like, in certain demyelinating disorders you can see these lipophages. Next, we are discussing about microglia, right? Elongated microglia, don't forget, elongated microglia are seen in neurosyphilis. Jitter cells or Ortega cells are also called as lipophages. They are nothing but the lipophages which are seen in demyelinating disorders. Okay, these macrophages are going and eating up the myelin. So these macrophages are filled with the myelin inside them. Okay, next, sir, now next microglia thing that is called as a microglial nodule. Microglial nodule. Sir, what is this microglial nodule and in which condition you will see it? So microglial nodules in the central nervous system are going to be seen in a condition called as HIV. If a person is having human immunodeficiency virus, then he can have this microglial nodules, and I will show you the microglial nodule. See, this is the microglial nodule. Okay, all the microglia are sitting here in one single place in the central nervous system. That is the microglial nodule. So simple, microglial nodules on autopsy or on biopsy is seen in patient who is having human immunodeficiency virus. Okay, next, sir, what is neurophagia? In which condition you will see the neurophagia? Okay, again I am talking about the same microglia are eating the neurons. Now these microglial cells are going and eating up the neurons. Okay, which is something bad, which is seen in a disease. So neurophagia, let me write, neurophagia is seen in polio. Okay, neurophagia is seen in polio. So I hope you already know it. See, in polio what happens, you will get this virus. Okay, polio virus, you are going to acquire the polio virus. The patient is going to get the polio virus. Now what happens, that polio virus is going to enter into the central nervous system. Now where it will come, the polio virus, it will come to this part of the spinal cord. Which part, sir? This part. What is this part of the spinal cord? These are called as the anterior horns or ventral horns. I hope you already know it. So the anterior horns or the ventral horns are motor in function. From this area, it's a motor neuron. See, this is the motor neuron. Alpha motor neurons are coming out. These alpha motor neurons, where they will go? They will go to the skeletal muscles, which helps in the contraction of the skeletal muscles. Now what happens in polio? The polio virus enters into your body. The polio virus will come and they will damage this area, the anterior horns or the ventral horns of the spinal cord. When the anterior horns are damaged, means the motor functions are going to be lost. Okay, so what exactly happen is, so these neurons which are infected with this polio virus, now the macrophages will come and destroy this area. The macrophages are coming and eating up the neurons in this area. Okay, so the anterior horns are damaged. So the damaged neurons are eaten up. The damaged neurons are eaten up by the macrophages. So that's why neurophagia. It is seen in polio. The damaged alpha motor neurons are being removed by the macrophages. Okay, so done. So one important point which I want you to know here is neurophagia. It's seen in polio. It's the ventral or anterior horns are damaged. Okay, next, what else I should teach you is the astrocytes. Let's discuss about the astrocytes now. Okay, here don't forget this is the microglial nodule. After this, now let's discuss about astrocytes. So what are the important points about the astrocytes? Astrocytes are the abundant cells. Okay, so they are the most abundant cells. Second one, these astrocytes are the one which are involved in the formation of the blood-brain barrier. Forms blood-brain barrier. Forms blood-brain barrier. and astrocytes are also going to involve in wound healing and injury. Involved in wound healing and injury. Wound healing and injuries. So astrocytes are the abundant cells, they form the blood-brain barrier and they are involved in wound healing and injury. So done. So these are the 3 important points which I want you to know regarding the astrocytes. So one more important point which I want you to know is the astrocytes contains the intermediate filaments. This I have already taught in the physiology also. Now inside the astrocytes there are the specific intermediate filaments are present which are called as a GFAP. Okay, glial fibrillary acidic protein. It is the intermediate filament. It is the intermediate filament present in the astrocytes. It is present in the astrocytes. Now, whenever there is damage to the astrocytes, okay, now whenever there is damage to the astrocytes, now this glial fibrillary acidic proteins, they are going to precipitate and they are going to form certain body like inclusion like things. What exactly are they, sir? Okay, what exactly are they? Let me write one by one. Okay, these are not the things. Actually, it should be a different image, but anyway. So, yeah, here I am showing you. So, let me tell you. See, there are elongated eosinophilic. Okay, elongated eosinophilic worm-like bundles. Okay. So, on the histology, what you are seeing here is in the biopsy, whatever you have taken, they are elongated eosinophilic worm-like bundles. What they are called as? They are called as Rosenthal fibers. Okay, they are called as what? Rosenthal fibers. So, what is the importance of this Rosenthal fibers, sir? See, these Rosenthal fibers, they are the pathognomic. Whenever you see the Rosenthal fibers, it means that the astrocytes are getting damaged. They are pathognomic. They are pathognomic of astrocyte pathology. Now you can ask me, sir, if there is Rosenthal fiber means, how we can say that astrocytes are getting damaged? Why it indicates astrocyte damage? Because Rosenthal fibers, they are nothing but our glial fibrillary acidic protein. So, it is made up of what? So, the composition of the Rosenthal fibers is glial intermediate filaments. Okay, glial intermediate filaments, which is nothing but GFAP, glial fibrillary acidic protein. Not only that, it is also made up of heat shock protein 27, and that is a question which was asked in the exam, and ubiquitin. Okay, ubiquitin. So, these Rosenthal fibers, they indicate astrocyte injury. That is the one point which I want you to know. Next, what else I want you to know is, sir, in this image what you are seeing? See, here these bodies which you are seeing on the histology, these are polyglycosan bodies inside the astrocytes. Okay, seen in degenerative changes. So, these bodies are usually seen with the aging, sir. Okay, they are usually seen with aging. So, these bodies, these polyglycosan bodies which are seen in the astrocytes with the degenerative changes like aging, they are called as corpora amylaceae. Okay, they are called as corpora amylaceae. Okay, corpora amylaceae. So, corpora amylaceae is nothing but this polyglycosan bodies, that pink color, okay, the bodies which are seen inside the astrocytes. These are not Rosenthal fibers. Rosenthal fibers are worm-like. If they use the word worm-like, they are absolutely about the Rosenthal fibers which are made up of the glial fibrillary acidic protein GFAP and heat shock protein 27. They are seen with the astrocyte damage. These corpora amylaceae is usually seen with the degenerative changes, usually with aging. Okay, usually with aging it is seen. Then what are these red neurons? Okay, what are the red neurons? Here it's there. See, these are the red neurons, sir. Okay, in this image whatever I am showing you, see these pink color things, they are the red neurons. When you will see this such red neurons, they are seen 12 to 24 hours after hypoxic injury. Okay, so 12 to 24 hours after hypoxia. Now the patient is having hypoxia and the neurons are dead. Now these dead neurons are going to be so much eosinophilic, pink color. They are so much eosinophilic. Okay, so they are eosinophilic. They are eosinophilic neurons with loss of nucleus. So they are eosinophilic neurons with the loss of nucleus, which are usually seen with the hypoxic injury. So these are the red neurons. Now after the red neurons, what else I want you to know is, now let's discuss about the other type of cells called as the Alzheimer's cells. Alzheimer's cells. So what exactly are these Alzheimer's cells? Alzheimer's cells are nothing but the astrocytes. Okay, they are nothing but the astrocytes. How many types of Alzheimer's cells are there, sir? Alzheimer's type 1, Alzheimer's type 2. See, again I am telling you there is no relation between the Alzheimer's disease. These are Alzheimer type 1 and type 2 cells, which are nothing but the astrocytes. So Alzheimer type 1 cells are seen in a condition called as PMLE, progressive multifocal leukoencephalopathy, because of JC virus. Okay, when you get the JC virus infection, in that JC virus infection, in histology you can see type 1 Alzheimer cells, which are nothing but the astrocytes. Okay, type 2 Alzheimer cells are seen in encephalopathy. Okay, because of the ammonia accumulation, encephalopathy, also in Wilson disease. Okay, so Alzheimer cells are of how many types, sir? Alzheimer cells are of two types. They are nothing but the astrocytes. Alzheimer's type 1 is seen in PMLE, progressive multifocal leukoencephalopathy, and Alzheimer's type 2 is seen in Wilson's disease as well as encephalopathy. So Alzheimer's cells are also completed. Next, after this, let's discuss about the myelination. Myelination. So myelination of neurons. So how many types of cells are there? Who is causing the myelination? See, in the central nervous system, you know it. Sir, in the central nervous system, the myelinating cells are called as oligodendroglial cells. Oligodendroglial cells. In the peripheral nervous system, the cells which are causing the myelination of the neurons in the peripheral nervous system means it includes the cranial nerves and the spinal nerves. Okay, is the Schwann cells. Okay, Schwann cells. Now the point is, see, the point which I want you to know in the pathology is the myelination. So you are seeing the myelin, right? So what is the stain for the myelin? The stain for the myelin is Luxalfast. That's okay. See, optic nerve, some important points are optic nerve. Optic nerve is the second cranial nerve, right? It's a cranial nerve too. It's a second cranial nerve. As it's a cranial nerve, it's under central nervous system or peripheral nervous system. It's coming under the peripheral nervous system. All cranial nerves and spinal nerves are coming under the peripheral nervous system. So who should be doing the myelination? The myelination should be done by the Schwann cells. But one exception is, so this optic nerve, though it's a peripheral nerve, okay, though it's a peripheral nerve, but the myelination is done by oligodendroglial cells. Okay, oligodendroglial cells. Done. Okay, so these are the points which I want you to know regarding the myelination. Actually, the optic nerve, the second cranial nerve, okay, is actually considered as an extension of the central nervous system. It's an extension of the central nervous system. Okay, the optic tract, the retina, they are all considered as the central nervous system, sir. Okay, next. Let's discuss about the next type of cells which are called as the ependymal cells. This was a question which was asked in the 2019 exam, FMG exam, ependymal cells. So what are these ependymal cells? Ependymal cells, see, they are the lining cells, okay, of the cavities in the brain and spinal cord. See, this is the spinal cord. In the spinal cord there is a central canal. Okay, in the spinal cord, you know, there is a central canal. So the lining cells of the cavities, ependymal cells, are the lining cells. What they will line? They will line the ventricles in the brain. Ventricles in the brain, and they will also line the central canal in the spinal cord. Central canal. Now the important point which I want you to know regarding this ependymal cells is these cells will never regenerate, do not regenerate, and that's also tested in the exam. They do not regenerate. Okay, that's the one point. And for example, see if there is a tumor to these ependymal cells, then it is called as ependymoma. Okay, it's called as ependymoma. So such ependymomas, the tumor cells can drop into the CSF, they can drop into the CSF and they can go to some other place. So they will show ependymomas. The point which I want you to know is these ependymomas, they will show what kind of metastasis, drop metastasis. So drop metastasis is shown by which of the central nervous system tumors? Ependymomas. That's the point which I want you to know. Apart from that, what else is, let me add some more important points about the myelination and oligodendrocytes. See, there is a condition called as a measles. Okay, so measles, where the patient is going to have a fever, coryza, okay, maculopapular body rash on the especially in the children. Measles is because of which virus? Measles virus. Simple. Measles is because of the measles virus. See, this measles is going to cause damage to which cells? Oligodendrocytes. Okay, oligodendrocytes are going to be affected. When the oligodendrocytes are affected, that causes the demyelination. Measles, also called as rubeola. Okay, rubeola, sir. The measles, also called as rubeola, is going to cause damage to the oligodendrocytes, which is going to cause a demyelination. So this condition, where the central nervous system is getting affected because of the measles, this condition is called as subacute sclerosing panencephalitis. So this is a question which was tested in the exam. Subacute sclerosing panencephalitis is due to complication of measles. Measles is, it's a demyelinating condition. Yes, it is true. Okay, don't confuse with rubella. Rubella is German measles. Okay, rubella is German measles. Okay, so regarding measles, one point which I want you to know is, which is very much famous for the exam. If a child, okay, a 5-year-old child who is having a measles, definitely he is going to have, they will mention in the mouth, they will have Koplik spots. In the buccal mucosa, they will be having Koplik spots. It's like a keyword. Whenever you see the word Koplik spots, it's measles. That's it. Don't confuse with German measles. German measles is rubella. Okay, German measles, rubella is German measles. This normal measles is called as a rubeola. Okay, don't forget about that. And the next important point which I want you to know is, there is a condition in which you are going to have ground glass oligodendrocytes. Ground glass appearance or ground glass oligodendrocytes. It is seen in which condition? PMLE progressive multifocal leukoencephalopathy, because of which virus? JC virus. So JC virus is also going to cause damage to the oligodendrocytes, where the oligodendrocytes are going to look like ground glass appearance. If you look at the oligodendrocytes, in the oligodendrocyte this virus is going to be present. Okay, in the oligodendrocytes you will see these viral inclusions. Okay, because of the presence of this viral inclusions, it's going to give you ground glass appearance. So simple, ground glass oligodendrocytes are seen in JC virus. Okay, JC virus causing progressive multifocal leukoencephalopathy. Ependymal cells, lining cells, do not regenerate, shows drop metastasis. Ependymoma shows drop metastasis. Measles, Koplik spots, measles, subacute sclerosing panencephalitis. Optic nerve is second cranial nerve, but is lined by oligodendroglial cells. But the peripheral nervous system is lined by Schwann cells. Okay, and what is this? Alzheimer's cells, type 2 and type 1 Alzheimer's cells. Type 1 Alzheimer's cells are seen in PMLE, type 2 Alzheimer's cells are going to be seen in encephalopathy as well as Wilson's disease. And corporoamylacia is nothing but the accumulation of the polyglycosan bodies within the astrocytes seen with aging. And what are the elongated worm-like fibers seen in astrocyte injury? These are called as the Rosenthal fibers. They are made up of, they are nothing but, inside the astrocytes you will see these fibers. They are nothing but glial fibrillary acidic protein or the glial intermediate filaments, and also it is made up of the heat shock protein 27 and ubiquitin. And you know it, the astrocytes are forming the blood-brain barrier. Okay, and what are the red neurons? Red neurons are the dying neurons. They are the dead neuron, not dying. They are the dead neurons, which is usually seen 12 to 24 hours after the death of the neurons. The eosinophilic neurons with the loss of nucleus, they are the already dead neurons. Okay. Now what is this? This is a microglial nodule. Microglial nodule is seen in which condition? HIV. In poliovirus infection, which part of the central nervous system is getting affected? It is the anterior horns of the spinal cord. Spinal cord is a part of central nervous system. It's the anterior horns of the spinal cord are going to be affected. Okay, which is causing the motor loss or the paralysis. What are the jitter cells? Jitter cells are the lipophages. Jitter cells or hot egg cells are the lipophages, which is eating the myelin. And what is the stain for the myelin? Looks all fast. Okay, so with this, the basic things which I want you to know in the central nervous system pathology is completed. Hope the video is helpful. See you in the next video. Thank you.